Now let's spend some time reviewing the hepatitis viruses. There are 5 clinically relevant hepatitis viruses for you to know on your Step 1 exam. They are named alphabetically from A to E, including hepatitis A, B, C, D, and E. The hepatitis viruses are grouped together because they predominantly cause inflammation of the liver, also known as hepatitis. The clinical presentation of patients that are affected by this virus or these viruses include patients that present with fever, jaundice, and increases in their transaminases, or AST and ALT. These are classic findings for anybody who presents with hepatitis, whether it's from a viral infection, from a Tylenol overdose, or from alcoholic cirrhosis as well. So these are kind of non-specific symptoms, but they're symptoms that are seen in patients with liver disease. But it's important to remember that all these viruses, although they're grouped together and called hepatitis viruses, are very different from each other. 4 of them are RNA viruses, 1 is a DNA virus, and they all belong to different viral families. So let's quickly review the specifics of each virus as a group, and then we'll go through them in more detail individually. I want you to think about the viral family of each of these viruses quickly in your head before I review them. I want you to think about what family they're from and if they're a DNA or RNA virus. So starting with hepatitis A, what kind of virus is it? Very good, it's a picornavirus, or an RNA virus. Hepatitis B is a hepatinovirus, and it's the one DNA virus of the hepatitis viruses. Hepatitis C is a flavivirus, very good, another RNA virus. Hepatitis D is a delta virus. And hepatitis E is a hepivirus. So you can see we have 1 DNA and 4 RNA viruses that are all from different viral families. Another important fact about each of these hepatitis viruses that you need to know for your Step 1 exam is how they are transmitted. How are these viruses transmitted from human to human? Well, there's 2 main ways. One is by the fecal oral route, which stands for a virus is transmitted from feces or human feces into the mouth or into the gastrointestinal tract of another human being. This can be seen in contaminated water or other contaminated food items. The other way is through parenterally, and this is a route that's outside of the enteric tract, or outside of the gastrointestinal tract, usually through intravenous drug use or IV transmission, blood transfusion, sexual transmission. Those are your common forms of parenteral viral transmission. It's pretty simple. Hepatitis A and hepatitis E are transmitted through the fecal oral route. And easy to remember this is that hepatitis viruses that have vowels, A and E, are transmitted by the bowels. So you can remember the viruses with vowels are transmitted by the bowels or the fecal oral route. The other 3, hepatitis B, C, and D, are transmitted through various parenteral routes such as IV drug use, blood transfusions, sexual transmission, maternal-fetal transmission, etc. So these are your main forms of transmission, and here's a quick review of all the 5 hepatitis viruses. Hepatitis A virus is one of the hepatitis viruses transmitted by the fecal oral route, and it's most commonly acquired through consumption of contaminated water or contaminated food, particularly at fast food restaurants. Generally causes a mild flu-like illness with symptoms of jaundice as well as that watery diarrhea. Oftentimes patients have abdominal pain and generalized malaise. The key here with hepatitis A is that this infection is self-limited and generally does not progress to a chronic hepatitis or a hepatocellular carcinoma. However, it's important to know that in acute hepatitis A infection, we see extremely high levels of AST/ALT, up into the thousands. So it's a self-limited infection that causes a flu-like illness with watery diarrhea, abdominal pain, as well as jaundice, and it causes an acute elevation in AST and ALT levels into the thousands. There is an hepatitis A vaccination that's recommended for all children, patients with chronic liver disease, people that are traveling to high-risk countries, and those that live in high-risk communities. Hepatitis E virus is serologically distinct from hepatitis A. Remember, it's a different virus, it's hepivirus, but it closely resembles hepatitis A in the form of presentation. It similarly presents with a mild flu-like illness, some jaundice, and AST/ALT elevation. The key thing to know in the high-yield testable point with hepatitis E is that it's associated with fulminant hepatitis, or very, very bad hepatitis, in pregnant women. So this is the key hepatitis virus to know about and associated with pregnant women. causes a fulminant hepatitis that can lead to sudden death. It's a very significant, profound hepatitis that is associated with death in the pregnant population. So now let's start talking about hepatitis C, and then we'll come back and talk about hepatitis B. Hepatitis C is a flavivirus, an RNA virus that is transmitted or primarily acquired by IV drug use these days, and in the old days by blood transfusions. It can also be transmitted through sexual activity, however, not as easily as hepatitis B is, for instance. What makes hepatitis C so unique and such a problem is that it's the most common cause of chronic hepatitis or chronic inflammation and infection of the liver. More than 50% of hepatitis C virus infections result in chronic hepatitis. This is in comparison to hepatitis B, in which only roughly 10% become chronic. So hepatitis C, or chronic, you can remember the C for chronic, cause significant morbidity and mortality. Chronic liver infections with hepatitis C can lead to cirrhosis, chronic or end-stage liver disease, ESLD, as well as hepatocellular carcinoma. So you can remember this by using or remembering the 3 C's. The hepatitis C virus can cause cirrhosis, end-stage liver disease, chronic liver disease, as well as hepatocellular carcinoma. Those are your 3 C's to help you remember the chronic liver disease caused by hepatitis C. Here's a picture of a cirrhotic liver. You can kind of see this fibrotic cirrhotic liver, as well as a nasty hepatocellular carcinoma in a man with long-standing hepatitis C. Here's a high-yield image showing the histological representation of nodular cirrhosis. This is a high-yield pathologic image, which you will likely see on your exam, where we see bridging fibrosis around parenchymal nodules of the liver. This fibrotic bridging is classic for cirrhosis and is not seen in a normal liver. Fortunately, there have been significant advances in hepatitis C therapy that have enabled us to treat successfully many hepatitis C infections. Can you think of the 4 medications that are used to treat hepatitis C? Very good. Ribavirin, ladipasvir, cimeprevir, sofosbuvir are the 4 medications now commonly used to treat hepatitis C. The hepatitis B virus is one of the more complicated hepatitis viruses, and it's one that's most commonly tested on step 1. Hepatitis B is a hepadnavirus, and it's the only hepatitis virus with a DNA backbone. An important thing to know is that not only is it DNA, it's a partially double-stranded. This is a unique feature of hepatitis B that you need to know. Partially double-stranded. What this leads to is a unique replication cycle that is commonly tested on your step 1 exam. So let's review it together. When the virus infects the host cell, its first order of business is to enter the nucleus and convert that partially double-stranded DNA into a complete double-stranded genome using the DNA polymerases. So we can see here, viral DNA is converted here into a complete double-stranded DNA. Now, with this double-stranded DNA in the nucleus, it is transcribed into mRNA as normal. So we have double-stranded DNA transcribed into mRNA, and this mRNA is then used for 2 separate functions. Number 1, it is translated into viral proteins that are used for assembly and release. So it's made into proteins. And also, specific to hepatitis B, it is reversely transcribed back into that double-stranded DNA that's specific to hepatitis B. So I think the key thing here, and a highly testable point about hepatitis B, is that we see this partially double-stranded DNA molecule, which is not often seen in biology, and therefore it's something that's easily testable on your step 1 exam. So remember, the double-stranded DNA enters the nucleus, is converted into a complete double-stranded DNA that is then transcribed into RNA, then used to not only make proteins for viral progeny and release, but also is reversely transcribed into viral DNA, partially double-stranded DNA, into more replication. Hepatitis B is transmitted parenterally, predominantly through blood transfusions, sexual transmission, and via the placenta. But the most common route of transmission, especially in the United States, is through sexual transmission. An important fact about hepatitis B viral infection is that it causes an acute and possible chronic infection. Most often, it causes just an acute infection that resolves on its own or resolves with systemic therapy, but 10% of the time we see a chronic infection similar to hepatitis C. The acute infection resembles any acute hepatitis infection, and it involves symptoms of jaundice, fever, and elevation in your AST/ALT. 90% of these infections resolve on their own or with medication, but roughly 10% develop this chronic infection as I mentioned. This chronic infection is similar to hepatitis C in that it can result in those important C's, or cirrhosis, or carcinoma in the form of hepatocellular carcinoma. An important learning point and something testable regarding hepatitis B is that this DNA virus will integrate into hepatocyte DNA and act as an oncogene, or a gene that puts cells at a higher propensity for forming carcinoma. So that is the oncogenesis of HCC and hepatitis B infection. We get the virus that integrates into the host genome and forms or acts and behaves as an oncogene. Finally, the hepatitis D virus. One of the hepatitis viruses that is not paid as much attention to because it's not that prevalent in the clinical world. The hepatitis D virus is actually a defective virus. Remember D for defective. And by itself, it doesn't really do anything. It's a non-issue. It's clinically insignificant. It's defective. However, in the presence of a hepatitis B virus infection, so when you get both hepatitis D and B, we see a sort of a super infection, a worse infection than when they're by themselves. So we see that hepatitis D needs hepatitis B to cause a clinically significant infection. So when hepatitis D and B are transmitted simultaneously from one human to another, we call it co-infection. However, if a patient is already infected with hepatitis B, they're in the hospital with hepatitis B viral infection, and then they contract hepatitis D, we call this a super infection. So this is a patient who already has hepatitis B and then gets hepatitis D in a separate instance, versus co-infection, both viruses, D and B, are transmitted at the same time.